I'm just nervous that I don't know, like just not looking like myself, I guess, or just getting botched.
I'm Dr. Dhir, a facial plastic surgeon in Beverly Hills. I want to show you my patients are real people who want natural results.
My name is Yasmin Maya. I'm from Carpinteria, California, and today I am here for a custom chin implant and rhinoplasty. So the reason why I'm getting this done is because I actually had a facial paralysis. With all the treatments that I tried doing before deciding to do something so permanent like this, I tried steroid shots, acupunctures, and pretty much nothing really worked. It did bring movement back to my face, but I pretty much lost all of the volume in my chin. It makes it seem like my chin's off to the side, and that's why I just wanna get an implant where it fills up that gap. And as well with my nose, I wanna get the rhinoplasties to straighten it out and just help with my breathing overall, because I do have such a hard time always breathing, and since I'm always on camera and I'm always talking so much, I tend to always run out of breath all the time, to the point that sometimes I might pass out, but I'm here to do it finally, and I'm excited.
Hello, Yasmin. Good morning.
Good morning.
How are you doing?
I'm good.
We made it to the big day.
Yes.
So good to see you.
Good to see you too.
Nervous or excited?
Both.
Good. Well, that's a normal feeling to actually have both. And I'm glad you're a little nervous. It's normal. Today we have a great staff who's here. We have the best anesthesiologist. We're going to walk in together to your favorite song.
Okay.
Have you chosen one yet?
Yes.
Which one are we going to listen to?
Selena, Bitty Bitty Bum.
Bitty Bitty Bum. All right. I love it. So we'll listen to that. Okay. We're going to walk in, and then everyone's going to take care of you. We're going to put a warming blanket on you. Mm-hmm. I'm going to be right there next to you. We'll listen to your music together. Okay. And then you're going to go to sleep. You'll have no memory of the surgery, and you have no pain. Okay? When you wake up, you're going to have a wrap around your head that's going to be holding your neck and everything kind of in place gently. And of course, you're going to have a cast on your nose, and you have some splints in your nose. You're not going to be able to breathe around it a little bit, but not too much. Don't expect to be breathing a lot. Mm-hmm. And if you feel like you can't breathe, just say 1, 2, 3, 4. And if you can hear your voice, you're breathing. Okay? You're going to have some swelling under the eyes, maybe some bruising. That's completely normal. And you have a little mustache dressing. I'll make sure your pain is controlled, and then you get to go home today, and you get to walk around, you get to eat, and you can also, get ready for me tomorrow, where I get to show you kind of everything that happened. Okay. And so just kind of re-summarize what we talked about is that, for example, the nose, you kind of wanted this for a while. We have 4 things we talked about. Number 1 is that we have that nasal hump here. Mm-hmm. We're going to make that straight to a little contour. We don't want a ski slope, right? We want to make it gentle, and straight is lovely, into a little contour. I think you showed me some of my own before and afters. So we're going to go for a little bit more of a contour. Number 2 is that these bones are a little bit to your right. Mm-hmm. We're going to straighten those, which means you also have a septum, which is this rubbery part here. Mm-hmm. It goes straight back, and it's for breathing. It's probably crooked in the back on your left and to the front to your right. So we're going to straighten it, and you should be able to breathe much better. That's our goal. Mm-hmm. All right. Number 3 is that we want to just refine the tip. We don't want to make it pinched. It's a little circular, but not too bad. We just want to bring it in just a little bit. Mm-hmm. And most importantly, we want to support the nasal tip, because when you smile, it plunges downward, and it brings, when we look at your eyes, our eyes come down because there's more weight. By supporting it just ever so slightly, when you smile, it should stay up and keep, when people meet you, this will be staring at your eyes. So we just want to support the tip, and we're not going to do it up. A lot of patients ask me like a peg or things. We're not going to be looking into your nostrils. We're just supporting it so it looks natural. Okay. That's our goals for the nose. Is that pretty much what we had spoken about before? Yeah. The chin was the real interesting part. Yeah. So number 1, symmetry was on your mind. And then also we talked about you wanted a little bit more projection. Yeah. Is that correct? Mm-hmm. In the world of just getting a chin implant, we talked about my little stick test. We go from the upper lip to lower lip, and we want to go right behind that line. So you're pretty close. If you just wanted symmetry, I would have been completely fine with it. You wanted a little bit more strength. Mm-hmm. And so we wanted to go very small. We made it to like a small level that we could probably do just to support it, to give a little bit more projection. Yeah. And that would actually harmonize the face. And I was completely fine with that. So either symmetry and a little projection, both I was okay with. But you had a very interesting desire, which is that you actually like the developed side. Mm-hmm. So now we get to the point is that we can use a technology to kind of get what I wanted to give you was we keep the good side and we just fill the right side. Yeah. All right, are you ready to see the model? Mm-hmm. First, feel a model, a 3D model of your jaw. And so this is a model of your implant. It comes in silicone once you decide that this is the right one. So what happens is it clicks. And now you can see from base view is that it's straight. Your midline is here, and it actually fills more rubber. There's gonna be more rubber on this side. So I added some projection. We use kind of the same architecture, and then the computer makes it here, and now you have a perfectly midline chin.
So crazy how it all comes together.
So this is your custom chin implant. It clicks into place.
And will this implant move or anything?
That's a great question. So this comes in silicone just like any other implant. It's not silicone gel like a breast implant, it's actually rubber. So it moves around, it's soft. And what this comes in is that it has all these points that we made so that it kind of fits. So if it wants to move, it has to do a lot of strength because it's customized. You see this little bony prominence right here?
Yeah.
So we made a little lip around it so that it fits right on that bony prominence. That's gonna let me know that this little curvature here is in the right spot. Okay. So as the body heals and it wants to move it, it should keep it in place. Are you ready? What makes the custom implant so special is that I'm able to design it exactly how the patient wants. And now I'm excited to show you how I'm going to fit this custom chin implant onto her chin. Let's do this. The incision is made on a natural crease of the chin. You can see right here, here's a crease. We all have a crease that's natural, and often, most of us actually have a scar there from when we were children. We bump our chin and it actually ends up usually being around here because that's where the chin bone is. What we're going to do is we're going to make an incision. We mark the straight line. I kind of do it in a gull wing style. The reason is that as our chin pulls down, if it's at an angle, it pulls down to straight. So we mark it so that it heals really well. No one usually sees this. Only dogs look up and they see it, and that's about it. So we're going to enter through here, go right to the chin, and we're going to put the custom chin implant in place. And the two spots that we worry about are nerves. So we have sensation nerves that are here and here. We're going to look for those, make sure they're safe. And other than that, it's a very beautiful, meticulous procedure. So here's the top view of the chin implant. When I was customizing it, I made a notch here because this is going to fit on a natural bony projection or protuberance she already has. This will help me when I fit it, make sure that I'm exactly in the right position, and that's the power of the custom implant. And this is the wing on her left. Make sure that the nerve is out of the way and I have a right channel. Okay, so we've inserted our custom chin implant in place. You can see it here, the silicone. Because the bone is now symmetric, I have to start looking at the soft tissue because she did have soft tissue loss from the previous injections of steroids over the years. So we're gonna work on getting symmetry here, probably put some fat in here to try to get it to be more symmetric because the soft tissue when it drapes is never gonna be the same as what the bone looks like underneath. So we're gonna work on that, but as you can see, it fits really nicely. And from the bottom view, we're not done yet, but you can see that she's got a more symmetric jaw. We are done with the chin. We're now going to move on to the rhinoplasty portion. The reason we do the chin first is that we want to be sterile. Once we put an implant in, it has to be as sterile as possible. We can move to the nose now, which is semi-sterile, meaning the inside of the nostril, you can't get all the way back, but we didn't sterilize the outside, so now we can move on. This is the incision we're going to use. This is an open rhinoplasty approach. You can use a closed approach or an open rhinoplasty approach. The open rhinoplasty is a scar here. No one again sees it. It's under the nose. Big discussion is scarless or no scars. There is a closed approach where all the scars are on the inside. I think it's the most important to choose a procedure what's best for the job. We have a hump removal. We have a very pinched nose here. We got to reconstruct the tip. I think the open approach is a better approach for me so I can see everything and get the result that I want. You can do everything closed, but sometimes you can't get certain maneuvers that are easy, so either approach is fine. I do both, and I feel like I picked the one that's most comfortable. What you're seeing is the tip cartilages that make the cartilage in support of our front of our nose. As you can see, it's very wide. So we're going to work on refining the tip by doing some sutures and some cartilage grafting. So we're going to be seeing what we do to change up the tip. Also, we have a nasal hump here. We're going to take that hump down. So this is the external approach. We're going to be doing all our changes here. So this is going to close here. And as you can see, we have a straight dorsal with a gentle contour, and like a little break here and a little bit tip elevation and coming down. So we have a nice contour. We are all finished.
It's been about 3 months already. And so far, I mean, it's been great. So the healing process was actually pretty easy. Like, I didn't really have any difficulties or anything like that. It was really smooth, I would say. For the nose, I felt nothing and actually breathed, which was crazy. Even having those little things inside of me on my nose, I was still able to breathe. And the chin, the only thing is that the first couple of days, I just kind of felt everything super tight. But it was nothing other than that. It was just pretty, like a really smooth, like, recovery. So it's affected me in a positive way just because I feel overall more confident. It's not like back then I wasn't confident, but now I just feel 100% there now. And what I love to always let my followers know is that do what makes you happy. And this is something that truly I felt like I needed in my life just because I've always wanted it and I knew that I wanted to make this change. And so me knowing that now I did something that makes me super happy, I am more confident now to let out all my other stuff that I just love talking about, which is makeup, fashion, and beauty and all that. So it's just really affected me in a positive way.
Welcome back, Yasmin. How are you?
I'm good, and you?
Doing great. How are you feeling?
I'm feeling great. Overall, more confident, that's for sure. Yeah.
Some of those goals that we were talked about, those motivations that you want to get, have we hit a lot of those points?
Yeah.
Okay. Let's talk about the nose first. We had those goals of getting that contour, refinement, support. We're in a really great spot. I'm enjoying it. I feel that
I love it.
Looking at it. And how do you feel on your angles and your shots and all the pictures you take?
Every time I take a different picture, I'm like, oh my God, it looks so good. Overall, I love it.
And the chin was a completely different conversation.
Yeah.
We had that tilt to the left. Of course, we talked about either putting it back to the midline. You also told me that you liked that width. You wanted the other one to match it. We also had some of those soft tissue volume thinning. So we put a custom implant that gave a lot more symmetry. We put some fat in that area so that we could fill it. And then we've been touching up with little bits of filler just to kind of help it through the healing process to get it as symmetric as we can.
Yeah.
And the custom implant process is as close as we could get. And I'm really glad you took that option because, as you can see, it's developing.
Yeah.
And now, of course, this is a different emotional experience.
Oh, yeah.
How are those angles treating you now?
I am not embarrassed at all anymore, like of showing just like my chin, especially when I'm applying makeup there. I would always find myself cutting those parts of the video out just because like I just didn't want the focus to be on there. Now I really don't care. I just show it now in the video.
When you did the makeup before, were you contouring those areas but not showing it?
I was just not showing it.
But you were contouring and then would fill it?
I would try to always like mimic the idea of that it was somewhat symmetrical. It was really hard to do anyways, but now it's like, oh, thank God.
So we're saving time on makeup and video editing.
Yeah.
Oh my gosh, you found so much time. What have you been doing with all your time now?
Just enjoying my life now.
That's great. Released.
Yeah.
All right, so to finish up on the chin, what I'm seeing now is that we're at the 3-4 month mark. We've been working on it. It looks so great. I'm going to continue following you through the year. I may have to put little bits of filler just to help it along its process. And then, you know, the 9 months to a year is that final result. And I think we're already on a roll to get there.
Yeah.
If you're feeling confident at actually applying makeup now with, you know, showing your chin on video, that's really empowering. I'm glad that I got you that freedom. That's what I wanted for you, and again, I'm so honored and proud. I'll probably see you in a few months, and we'll continue to follow.
Yeah.
All right?
Thank
so
you.
Good to see you. You look great.
Thank you. My experience with Dr. Dhir has been amazing. He's been very, very supportive. He knows how much this meant to me, how emotional this was for me, and he's just been amazing, like right there by my side through every step of the way, and that's something really amazing and that I actually appreciate from him.
All right, guys, I'm glad you guys got to meet Yasmin. It was a great procedure and a wonderful result. We did a rhinoplasty procedure to get that contour that she's always wanted. We wanted to refine that tip and, of course, support that base to overall give that refinement of the nose that she always wanted. Second, the chin had an asymmetry to her left that she was very conscious about and had to contour often. The custom chin implant process is the state-of-the-art technology to get that symmetry to as close as we can get. And as you can see, the custom chin implant process delivered on what we wanted. Yasmin's also uploaded her own video discussing her emotions and personal feelings about the journey. There's a link below in the descriptions. Please watch her episode. You can continue to follow us on Instagram at Dhir Plastic Surgery, and we look forward to seeing you soon.